As pelvic therapists, we should care about traumas and know how to address them because it will help our client achieve deeper healing. So, for that mother who had that traumatic birth and we are doing pelvic work, we can use language like, "It is not uncommon if you feel nervous about this exam. It is totally relatable because of the pain you experienced at birth," or fill in the blank. So, what I need you to do is exhale and stay with me, and we will progress only as you can. We will never push into pain. When you use that language, your postpartum client A is going to feel so much more comfortable and breathe a sigh of relief, and she is going to progress better and quicker with her pelvic work. For the client where you unearthed that trauma after some deeper work, you can use language like exhale, let that go. Don't try to control your tears, let it come. Release is okay because you are supported. I am here. Exhale. Your body needed to do that. You are safe. You're okay. Exhale. And once they regulate, their breath slows down, you can progress. You don't have to psychoanalyze, but you can progress. So trauma comes from the Greek word wound, and as pelvic therapists, it helps us be better at helping our clients if we understand the nature of formation of the trauma, its progression, and its healing. So some traumas or wounds can be fresh, like that postpartum mom who had a difficult birth experience. She's the one who's probably going to refuse an internal pelvic exam day one, or when you try and offer an assessment and she is happy for it, as you do the pelvic exam, there is a pulling away or a tightening or a fear response or emotional response and tears when you try and just approach and do that internal pelvic exam for the first time. That is a fresh wound. It is raw, it hurts just on the approach or at the very beginning. Older traumas and better healed wounds are interesting and a little bit trickier. These are the people who you work with and it's their third or fourth time you're doing internal pelvic work, and you hit a knot, you hit a spot, you know it, you feel this release, and suddenly out of nowhere there is sobbing, there is crying, there's this big release emotionally. And what you just did, my fellow healer, is you went through the layers of their physical scabs or physical healing and helped them have an emotional release, which will help that wound or trauma close in the long term. You did somatic release.